always make sure that patients are not pregnant, and if the sexually active woman is using these drugs, make sure that they are using effective contraceptive methods. Okay, the excessive production of sebum, what it does, it favors this excessive production of sebum in the skin, it favors the growth of some bacteria. The comedone which is present inside the skin is called a whitehead. The same comedone sometimes it will be seen outside the skin, that is called blackhead. So those who applies tretinoin on the face, don't expose to the sun, it can cause skin cancer. Hello students, in today's class let us learn about retinoic acid, retinoic acid and its derivatives. Retinoic acid and its derivatives. This concept is very important in dermatological diseases, especially in acne vulgaris. Acne vulgaris, this concept is very important, and these drugs are also called as retinoids. Retinoic acid derivatives are also called as retinoids. So in retinoids actually we have 4 generation of drugs. Don't confuse, this concept is very easy. Retinoic acid derivatives are simply called as retinoids. These retinoids are having 4 generations. The first generation retinoic acid or retinoids is called retinoic acid. The name of the drug is retinoic acid, which is also called tretinoin. Tretinoin is the first generation retinoid, and the second generation retinoid is acitretin. Acitretin is second generation retinoid, and the third generation retinoid is adapalene. Very important. This drug is very important, and in competitive exams you will expect this question. I'll try to explain in detail about this adapalene. Adapalene and tazorotin. These two drugs will come under third generation retinoids, and the fourth generation retinoid, which is the latest one, trifarotin. The name is trifarotin. This is the fourth generation retinoid. So retinoids or retinoic acid, all these drugs are very similar, or they are analogues of vitamin A. First point, retinoids and retinoic acid derivatives these are the analogues of vitamin A. All these drugs are very similar to vitamin A. Okay, this is first important point. And second important point about retinoids or vitamin A or retinoic acid derivatives, these drugs are very effective for acne vulgaris. This is another important point. Clear? First, retinoic acid derivatives are called as retinoids, and in retinoids we have 4 different generations. In that, the first generation retinoic acid derivative is retinoic acid. Retinoic acid itself is a drug, and the name of that retinoic acid is tretinoin. It is the first generation. Second generation is acitretin. Third generation is adapalene and tazorotin, and the fourth generation retinoic acid derivative is trifarotin. Okay, so these are the examples of drugs. These are very effective for acne vulgaris. These are vitamin A derivatives, or they are called vitamin A analogues. Simply we call them as vitamin A analogues. Here you should not confuse adapalene and tazorotin. These two drugs are not vitamin A analogues. However, these both the drugs are having same actions like retinoids, same actions like retinoic acid. That's why they are considered as retinoids. Okay, now let's understand the mechanism of action. First we'll discuss about retinoic acid. Retinoic acid is also called tretinoin. Just now I told tretinoin. Retinoic acid is also called tretinoin. Before understanding about tretinoin, let me explain what exactly is acne vulgaris. Okay, see, acne vulgaris is a dermatological disorder which is very commonly affected to adolescents and young adults. Young adults. First point, acne vulgaris is a dermatological inflammatory condition where it is characterized by formation of pimple and it is formation of hyperkeratinized tissue, rashes, itchy skin. All these things are characterized in acne vulgaris. Okay, acne vulgaris is a dermatological condition which is commonly seen in adolescent and young adults. Adolescents means the age between 10 to 19, the age at puberty, around puberty we can say, around puberty. Okay, actually at the age of puberty, excessive production of androgens. Okay, androgens. So due to the hormonal changes in this age, adolescent age, this androgen production will cause acne vulgaris. Acne vulgaris. I'll explain the exact mechanism how adolescent patients will develop acne vulgaris and how androgens will potentiate, how androgens will aggravate this condition. Okay, first point, acne vulgaris is one of the dermatological inflammatory condition which is characterized by pimple and rash on the skin, especially on the face. It's called acne vulgaris, commonly seen in adolescent and very young adults. Sometimes acne vulgaris is also seen in females at menopause. At menopause also this condition can be seen. I'll tell that mechanism as well. Okay, now see, this acne vulgaris is seen in adolescent populations and young adults. Okay, here if we see the exact mechanism, let me tell you. See, in young patients or adolescent patients, the skin excessive production of sebum. Actually on the skin we have sebaceous glands. We call them as sebaceous glands. The sebaceous glands will produce sebum, which is a oily secretion. Okay, these sebaceous glands will produce oily secretion. In adolescent populations, these oily secretions are produced in excess amount. The excessive production of sebum, what it does, this excessive production of sebum may be due to age, especially in adolescent and in adults it is commonly seen excessive production of sebum. It may be aggravated due to diet or due to body weight or due to any other. We have racial cause, we have some other risk factors. Okay, patients with severe dehydration, there are a lot of reasons for excessive production of sebum. In that, the main risk factor is age, which is adolescent age. So at this age, the excessive production of sebum, what it does, it favors this excessive production of sebum in the skin. It favors the growth of some bacteria in the skin, and the name of the bacteria, very this is important. The name of the bacteria is Cutibacterium acnes. Cutibacterium acnes. This is the name of the bacteria. Actually, in adolescent age, due to the excessive production of sebum from the sebaceous gland, this excess sebum, what it does, it will favor the growth of bacteria. Actually, this Cutibacterium acne is a gram-positive bacteria. It is anaerobic gram-positive bacteria. This actually nowadays we are calling this Cutibacterium acnes. Previously it was called as Propionibacterium. Bacterium acnes. Okay, Propionibacterium acnes is the old name, and nowadays we are calling this bacteria as Cutibacterium acnes. This bacteria is grown in the skin, on the face, wherever excessive sebum production is seen. And this excessive growth of bacteria, what it does, it will produce some toxins, and these toxins will again produce some pro-inflammatory mediators, and with that it causes inflammation, and with that it causes rash. And with that it will develop acne vulgaris. You can see the skin patches. This is acne vulgaris. Okay, I'll try to explain you how acne vulgaris is formed and how exactly it is developed. Now you see, As I told, excess deposition, excess deposition, here you can see due to development of bacteria, and in adolescent age due to this production of pro-inflammatory mediators, what will happen, these pro-inflammatory mediators and all these things, these will potentiate the formation of more keratinized tissue, more keratinized tissue. Simply we call it as comedone, comedone, comedone. Comedone is the overgrowth, it is the overgrowth or excessive deposition of keratin. Excessive deposition of keratin, what it does, it will form overgrowth, and this overgrowth will develop as comedone. So you can see this is the comedone. This comedone which is present inside the sebaceous gland or inside the pore, inside the skin, this is called whitehead. The comedone which is present inside the skin is called whitehead. The same comedone sometimes it will be seen outside the skin, that is called blackhead. So this whitehead and blackheads are nothing but they are comedones. They are excessive growths, overgrowths, deposition of keratin protein. This is called comedone, and this formation of comedone is nothing but acne vulgaris. I think you understood what is acne vulgaris. Acne vulgaris is caused due to age factor, and with that excessive production of sebum will develop bacterial growth. This bacterial growth will cause accumulation of pro-inflammatory mediators, and with that it will potentiate the deposition of proteins like keratin, and this keratin will be accumulated and it forms an overgrowth which is called comedone. And this comedone accumulation, this comedone is nothing but acne vulgaris. And in comedone we have whitehead and blackhead. Whitehead is present inside, the comedone which is present inside is called whitehead, and the comedone which is present outside the skin is called blackhead. And this is acne vulgaris. I think you all are following me. So now let's discuss how retinoic acid, we'll come back to the retinoic acid. Retinoic acid is called Tretinoin. It is the first generation retinoic acid derivative, or first generation retinoid, first generation retinoid. This Tretinoin has many actions in the skin. What it does, this will potentiate the removal or expulsion of open comedone. Just now I told open comedone means the comedone which is present outside the skin, which is the blackhead. Okay, this blackhead is removed, and this removal is potentiated by Tretinoin. What Tretinoin does, Tretinoin will remove the open comedone, and it also helps for the transformation of closed comedone, which is called whitehead. Okay, whitehead is transformed into open comedone. That means here simple, retinoic acid and tretinoin, what they are doing, they are decreasing the formation of comedone, and they are removing the already formed comedones. Already formed comedones are removed, and further it will decrease the formation of new comedones. This is the final outcome of retinoic acid and tretinoin. This is the mechanism of all retinoic acids. And in detail, if we see the mechanism, how they differentiate the cells and they help in formation of some other cyclic AMP, cyclic GMP, and all that is not required for us. Retinoic acid, it removes the closed and open comedones, simple, and it decreases the formation of new comedones, simple. This is about tretinoin mechanism. And see, for tretinoin we have some drawbacks, let me tell you. So tretinoin has some drawbacks. What tretinoin does, initially when tretinoin is applied on the skin, it causes erythema initially. Red skin is seen, and it causes dryness or dry skin. However, the prolonged use will decrease this ADR and it will improve the skin condition. And one should we have to remember that tretinoin, when tretinoin is applied, always suggest the patient to use tretinoin only on dry skin. They should be applied only on dry skin, and always advise the patient to avoid the corners of nose. Always avoid the corners of nose, mouth and eyes. So the tretinoin should not be applied at the corners of nose, mouth and eyes, and they should not be applied on mucous membranes. This one we have to be very careful. Apply only on dry skin and avoid on corners of nose, mouth and eyes. Okay. And one more important point here, initially I told it causes erythema, right? And here always remember, the prolonged use of tretinoin has some advantages here. The prolonged use of tretinoin, what it does, it will promote collagen synthesis, and because of this collagen synthesis, it also helps in formation of new blood vessels, and with that what it does, it decreases the wrinkles and lines on the face and it glows the skin. That means we can say the people who are getting older, for older populations, it can decrease the wrinkles on the face and lines on the face. Okay, this is one advantage. It can make the face glow and it can make the face to appear like a young person. Okay, so this is the advantage, and this is potentiated due to formation of collagen and new blood vessels, and it tries to glow the face and decreases wrinkles and lines on the face. This is one advantage. Okay, and some adverse effects if we see with tretinoin, it is a first generation retinoid. It can cause erythema as I told, and sometimes it causes dryness, sometimes irritation can be seen. Okay, and always remember, when tretinoin is applied, don't advise the patient to expose to the sun. They should not be exposed to the sun, because UV rays with tretinoin can cause tumor. It is tumorogenic. That's why those who applies tretinoin on the face, don't expose to the sun. It can cause skin cancer, so avoid sun exposure. This is important point. If in case we go under the sun, we should apply sunscreen and we should go. This is important point. Okay, now the next generation one, as I told, tretinoin has some disadvantages, like it can cause dry skin, it can cause irritation. And one more very important point I forgot to tell, tretinoin when it is applied along with benzoyl peroxide. Actually, benzoyl peroxide is very commonly applied with retinoids. So tretinoin and benzoyl peroxide, when they are applied, it has some incompatibilities. That's why tretinoin is never combined. It is not effective with benzoyl peroxide. That's why tretinoin is having very limited use in the market. So to overcome this, we have one more drug which is Adapalene. Just now I told, Adapalene is the third generation retinoid. This Adapalene has some advantages over tretinoin. This Adapalene, actually it is a derivative of naphthoic acid. This is one important point. It is not directly linked with the retinoids, with the retinoic acid and vitamin A. It is the derivative of naphthoic acid, and it has same actions like retinoic acid. That's why it is considered as retinoid. Okay, retinoid means it is having same actions like retinoic acid. That's why it is called retinoid. But chemically, if you see, it is not directly related to vitamin A. Anyways, the Adapalene is the third generation retinoid. It has some advantages over tretinoin. It can be applied along with benzoyl peroxide, it has less irritant property, less irritation, okay, and it has no symptom of erythema, okay. So these are the advantages over tretinoin. That's why adapalene is the best choice for acne vulgaris, okay. Acne vulgaris, adapalene is the best choice, and it is available as 0.1% topical gel, cream, and lotion, okay. You can see the example here, adapalene gel. Adapalene is the best example or best drug in retinoids, okay. So isotretinoin, there is one more drug called isotretinoin, which is very similar to tretinoin. Anyways, it has other drawbacks, okay. Isotretinoin and tretinoin are not used, okay. They are not used in pregnancy as well. That's why adapalene is the best choice among retinoids. And so this third generation retinoids are adapalene and tazorotene. These two drugs are most effective drugs, and the fourth generation also we have, which is trifarotene. Even this is also the drug of choice in upcoming days. So here let me tell you some important points about this adapalene and tazorotene. As of now, these both the drugs are most effective retinoids, and trifarotene is one more best drug in acne vulgaris. The older retinoids, which is tretinoin, and isotretinoin, these drugs are not effective in pregnancy, okay. They cause some adverse effects, like they causes erythema, and they have certain adverse effects like dryness, it causes dry skin. And if these drugs, tretinoin and isotretinoin, are advised in the patients, always make sure that patients are not pregnant, and if the sexually active woman is using these drugs, make sure that they are using effective contraceptive methods, okay. Effective contraceptive methods, this is very important. So if this is not followed, they may cause teratogenicity, because they are highly teratogenic. And here for adapalene, we don't have that much teratogenic efficacy. However, this tazorotene is also having that teratogenic property. That's why even in tazorotene, advise the females not to get pregnant. So among all these retinoids, adapalene is one of the best drug, and it has few advantages over tretinoin, isotretinoin, and retinoic acid, okay. So this is about retinoids. Let me summarize some points about retinoids and retinoic acid. See, retinoids are the drugs which are used for acne vulgaris. They are very similar to vitamin A. So all these are considered as retinoic acid derivatives or retinoids. So in these we have four generations. First one is tretinoin. Tretinoin is the first generation retinoic acid derivative or retinoid. And second is acitretin. Acitretin is second generation retinoid. And in third generation retinoid, adapalene, tazorotene. And in fourth generation retinoid, we have trifarotene. So these are the examples of drugs. When retinoids are used, always remember they should not be given in pregnant ladies, or anyone should not plan for pregnancy. One important point. And if they are used, please don't expose to the sun. This is another important point. And these drugs, retinoids, are very effective for acne vulgaris, and they are used along with benzoyl peroxide. And here in benzoyl peroxide, I told one point, tretinoin is not compatible with benzoyl peroxide, whereas adapalene can be used along with benzoyl peroxide. That's why adapalene and benzoyl peroxide combinations are available in the market for acne vulgaris. Okay, so that's it about retinoids. I think you learned something from our video. If you learned something, please don't forget to like our video, subscribe it, and share to your friends. Thank you.